Hello, it's Dr. Silva here with Interventional Orthopedics of Washington. Let's talk about Craniocervical Instability, or CCI. What it is, why it can cause so many symptoms, and also how we treat it here at Interventional Orthopedics of Washington. In simple terms, the craniocervical junction is where your skull meets the top two neck bones. Those bones are held steady by a network of ligaments, including the nuchal, posterior atlanto-occipital membrane, apical, alar, transverse, and capsular ligaments. In CCI, those ligaments can be too loose or injured. When that happens, the head and upper neck can microshift with everyday motion. That instability can irritate joints, tendons, and nearby nerves and vessels, and even tug on the coverings around the brainstem. The result can be a long list of symptoms: headaches and migraines, neck pain, dizziness or lightheadedness, brain fog, visual or ear symptoms, jaw or facial pain, posture issues, and sometimes autonomic complaints like heart rate swings or temperature intolerance. CCI is common in people with hypermobility, including HSD or EDS, but it can also follow whiplash or repetitive strain. One challenge? Much of the medical community doesn't always account for CCI when evaluating chronic neck pain, headaches, or neurologic symptoms. Standard care can miss microinstability. Supine MRIs may look normal, so routine PT or anti-inflammatories may not be enough. That gap is why we do this work, to specifically address ligamentous laxity and joint stability with precision treatments and rehab designed for this population. How we evaluate you. We start with detailed intake forms, a careful history, and a focused exam looking at stability and movement control, not just flexibility. We rule out other causes: vestibular, neurologic, vascular, inflammatory, dental or TMJ, and more, and coordinate testing with your other clinicians when needed. For imaging, we use high-resolution ultrasound at the bedside to assess soft tissues, and fluoroscopy, when appropriate, to understand joint mechanics and guide procedures with accuracy. The goal is to understand which tissues are failing and why. How interventional orthopedics helps. Instead of jumping straight to surgery, we use image-guided biologic treatments to help strengthen and heal the stabilizers of the craniocervical junction. Prolotherapy to stimulate repair in lax ligaments and capsules. PRP to bathe injured ligament and tendon attachments with your own growth factors. Bone marrow-derived cell procedures for higher grade or stubborn cases where more cellular support is appropriate. We treat comprehensively, not just one spot, often addressing upper cervical facets and the posterior ligamentous complex, so the entire system shares load correctly. All injections are performed under ultrasound or fluoroscopy for precise placement. What to expect on procedure day. We clean the skin, numb the area, and guide very fine needles to the target tissues. Most patients choose local anesthesia, and conscious sedation is available when appropriate. Bring a driver if you opt for sedation. Afterward, expect soreness and stiffness for 1 to 7 days, occasionally longer, plus mild swelling. We generally avoid NSAIDs during the early healing window. You can use heat or ice in 30 on or 30 off cycles, protect the skin, and gradually return to activity as tolerated. Rehab, your multiplier. We pair procedures with a hypermobility-savvy rehab plan. Proprioception/balance work, mid-range isometrics, threading the needle exercise, and postural retraining. We extremely suggest to avoid aggressive end-range stretching that can aggravate lax tissues. Short-term bracing or taping may help while tissues remodel. Healing is gradual. Improvements stack over weeks to months, and some patients benefit from a series of treatments. Others need only periodic touch-ups. Risks and consent. Any procedure carries risks and no guaranteed benefit despite correct technique. When we use fluoroscopy, we keep radiation exposure to a minimum. These are elective treatments, and many uses of orthobiologics remain investigational and not typically covered by insurance. We'll review alternatives and answer every question before you consent. Why consider IOW for CCI? Because our approach directly targets the tissue quality and stability issues that often drive symptoms in hypermobility and post-trauma necks. We combine precise image guidance, regenerative injections, and tailored rehab And we can layer in functional medicine supports such as sleep, stress physiology, adequate protein, vitamin C or D, magnesium, hormones, and gut health to improve tissue resilience and nervous system recovery. If you plan multiple sessions, ask about package options. Bottom line, CCI is real and treatable. If you've been told everything looks normal, but you still feel unstable, Interventional Orthopedics offers a targeted path to stabilize, reduce flare frequency, and help you get back to the activities you care about, safely and step by step. Let's build the plan that fits your body.